Hello friends, what is ACL? ACL is a very important ligament of our knee which keeps our knee strong, stable and prevents the back and forth movement. It is one of the most commonly injured ligaments in our knee. How does it happen? ACL injuries are very common during contact sports, which involves sudden deceleration and pivoting movements of the knee. Immediately after the injury, you may hear a sound of pop and the swelling may increase substantially. What are you supposed to do when you have an acute injury? You should follow the principle of RICE, which is rest, ice, elevation and compression. You can use a knee brace to support your knee for some time. It is always better to consult an orthopedic surgeon to get yourself evaluated, the severity of the injury and the associated injuries like the collaterals, the meniscus, the cartilage injuries also. What are the treatment modalities for this ACL injury? Treatment is individualized to patients. It depends on age, it depends on the functional demands and activity levels. There are two options. First one is conservative, which means non-operative treatment. People who are ready to modify their lifestyle, who don't have high functional demands, who don't want to play sports can opt for this non-operative treatment. The emphasis is on muscle building and rehabilitation. The other treatment option is surgery. People who want to return back to sports, who have high functional demands, should opt for a arthroscopic ACL reconstruction. The emphasis is to give you a functional and a strong knee so that you can return back to your sports as early as possible. In either condition, whether you are opting for a conservative or a operative treatment method, sequential follow-ups with your doctor is very important for evaluation. Thank you so much. I would love to hear your experiences in the comment box if you ever had this injury.